According to dictionary.com, the definition of leukemia is a cancer of the bone marrow that prevents the normal manufacture of red and white blood cells and platelets, resulting in anemia, increased susceptibility to infection, and impaired blood clotting. There are different effects and severities of leukemia based on the patient's gender, age, and race. Even though many patients have died from this disease, there are also treatments to help prolong or even save their lives. I'm here today to inform you about the risks, symptoms, and statistics of leukemia. First, let's talk about the different types of leukemia. There are 4 main types of leukemia, and the first one I'm going to talk about is acute lymphocytic leukemia, which can also be known as ALL. According to MedicineNet.com, ALL is a blood cancer that's also called acute lymphoid leukemia and acute lymphoblastic leukemia. It is most commonly found in children under the age of 15. Another main type of leukemia is chronic lymphocytic, and it starts with the change of DNA a DNA cell called lymphocyte. It is most commonly found in people of 60 years of age or older. There are no preventions for leukemia, but they are working on it. The less known types of leukemia are acute myeloid, which occurs inside the bone. It grows from cells that are normally white blood cells. It's common in males of 65 years or older. This disease also develops really quickly. Another less common leukemia is chronic myeloid, which is found more so in adults than it is in children. There are 3 phases of this, which are the chronic phase, the accelerated phase, and the blast crisis phase. After knowing the different types of leukemia, it's important to know the symptoms and signs of each in order to look for them. Each case has different signs and symptoms, and acute leukemias have various symptoms which act quickly. And according to the Leukemia and Lymphoma Society, some quick symptoms are those such as easy bruising or bleeding, paleness, easily fatigued, and weight loss. Also, recurrent minor cuts and bruises, along with poor healing of these so-called minor cuts. Most symptoms are caused by the low level of normal blood cells, especially the white blood cells. Chronic leukemia symptoms are long-term and therefore go more unnoticed. Things such as infection, fever, abnormal pain, or feeling of fullness, enlarged spleen, lymph nodes, and liver. These symptoms are usually spotted during routine blood tests, and it is said that 1 in 5 chronic leukemia patients do not report any symptoms at the time. Leukemia is not limited to any gender, race, or age group. Especially in the United States, there are many various ways in people who have this disease. Other references from the Leukemia and Lymphoma Society state that there is an estimated 245,225 people that live with or are in remission from leukemia. It's said that 57% of the new cases of leukemia in 2009 were males rather than females. It's most commonly found in whites and is least commonly found in American Indians and Pacific Islanders. ALL is most common in children, especially between the ages of 1 and 7. From 2002 to 2006, leukemia presented 27% of all cancers in children under the age of 20. CLL increases among 50 years of age or older, and AML and CML increase among 55 years of age or older. Since many symptoms and signs of leukemia can be shown and predicted as other diseases and problems in the body, there are different tests done to diagnose that it is actually leukemia. Information found on MedicineNet.com says that complete blood counts are a main source of their findings and are done to check the number of blood cells and platelets and also cancer cells. Another type of test that is done is a bone marrow biopsy, which takes out the marrow from inside the bone, and they also find cancer cells in that. After finalizing the diagnosis, there are ways to treat, improve, and prolong lives. Leukemia isn't just a single cancer, it's multiple related cancers put together, and can be treated in various combinations and other things. There are 5 main approaches to treating leukemia. As said on healthcommunities.com, the main approach is chemotherapy, which kills leukemia cells by using strong anti-cancer drugs. Interferon therapy slows reproduction of leukemia cells to promote the immune system. Radiation therapy exposes cancer cells to high energy radiation, and the last approach is surgery, which removes the enlarged spleen, and then a large plastic tube is installed into the body in order to give medications and take blood samples. As L. Zhang and A.L. Demain stated in their book, Natural Products, Drug Discovery and Therapeutic Medicine, treatment is based on using poison against poison. As you can see, leukemia is a major cancer in the United States, and there are many symptoms, risks, and statistics that prove this. But on the upside, there are different treatments, and early diagnosis can help to save and prolong lives.